COVID-19 cases, though, push beyond 2,000 for the fourth consecutive day. State data shows 2,302 people have now tested positive since Saturday. The number of patients being treated in hospitals did dip a bit for a second straight day to 1,129. Sadly, 5 more deaths have been linked to COVID-19. And we're learning more about one of the hidden aspects of surviving COVID-19, particularly when it comes to young adults.
Multiple studies show cases are on the rise among people in their 20s. Katie Collette talked with one woman who battled the virus and has a warning for others.
At the time that I caught COVID, I was staying with my grandparents to help take care of my grandmother who had just fallen and fractured a rib.
A grandmother with a fractured rib and a grandfather battling blood cancer. Taylor O'Beer says she was terrified of her grandparents catching coronavirus, so she did everything she could to prevent that from happening. Then, something she couldn't stop.
I also found out about that time that a family member who had been around me had gotten COVID.
Not long after, Taylor says she got a headache that wouldn't quit. Then the fever and chills started. A first coronavirus test in July popped negative.
A week in, that's when the fevers are really bad. And the fatigue, I mean, I slept probably 12 hours a day each day. It was kind of crazy. Zero energy, zero appetite.
Taylor got tested a second time. This time, the results came back positive for coronavirus.
After about a week and a half, I started to feel normal. I wasn't getting a fever anymore. I didn't have the headaches anymore. I wasn't as low energy. But then that's when the breathing problems started.
This otherwise healthy 26-year-old says those breathing problems were deep and scary. With treatment, Taylor's symptoms ended after roughly 2 weeks. Her grandfather also made a full recovery, and miraculously, her grandmother never contracted the illness.
I kind of wish more people would take it seriously and be more cautious so we can kind of get over it together, because if we kind of had that mentality from the start, we might be in a different place now.
Katie Collette, News Nation, Norfolk.